Hello everyone, I'm Dr. Santoshi Nandigam, Consultant Obstetrician and Gynecologist in Cairns Hospitals, Kodambakkam, Chennai. Welcome to my YouTube channel. Are you doubtful about your baby's movements? Baby movement irka illaiyaanu solli romba doubtful irka. Well, the first thing that you should do is call up your gynecologist and inform about your feelings. So how do you identify? It's quite common for women to, just realize that the baby hasn't moved in the last couple of minutes. It's quite common for them to forget when the baby actually moved. Such situations where you have a doubt, these are the things that you're supposed to do. So sit down, recline your back, put your hand on your tummy, and try and concentrate on feeling for the baby movements. Literally put your hand on your tummy and concentrate for the baby movements. So most of us are, working. Most of us have, a lot of household chores. We get busy in whatever we are doing. And, when we are occupied, when we are concentrating on so many other things, we might not even perceive the baby's movements. So it is really important that for you to sit down, lean your back in a reclining chair, put your hand on your tummy and try and concentrate and know whether the baby is moving or not. So take about an hour's time. So if you still don't feel the baby moving, get up. Have a warm water. Have a glass of warm water or a warm milk. Walk for about 20 minutes. Again, go back to sitting position. Sometimes when you actually move your bowel, sometimes when you, have something really hot, something that you like, sometimes when you walk around, that'll actually help in identifying the baby movements. The babies usually go into a sleep wake up kind of cycle. It can last for about 90 to 120 minutes. So if you don't feel the baby movements in spite of all these things, you've gotten up, you've had your glass of milk, you walked around for about 20 minutes and still you're not able to feel the baby movements, and it has been 4 solid hours of absolute radio silence, that is the time you need to rush to the hospital. So you also have to watch out for the following symptoms like bleeding, leaking, spotting, any pain in your abdomen, any uterine tightness, the feeling of gripping sensation around your tummy. If you have any of these symptoms associated with no baby movements, that's your sign to go walk into a hospital immediately. For some women, they might have some kind of medical complications like pregnancy-induced blood pressure, pregnancy-induced sugar. Such patients do have to visit the hospital almost immediately as they realize that there are no baby movements. So once you reach the hospital with decreased fetal movements, what happens? So we run a graph called as a cardiotocograph. It watches for the baby movements. It watches for the contractions, for the uterine contractions. If the cardiotocograph says there is a pattern of cardiotocograph, there is it's similar to the way we take an ECG for the adults. So ECG for the adults is equal to a cardiotocograph for the baby. If the graph is good, and if the baby has been in kind of a sleep wake up kind of cycle, you will eventually start feeling the baby's movements. If the graph is bad, that is when probably the consultant might decide to admit you and take it further. So if you like my videos, please subscribe to my YouTube channel and follow for more. Thank you so much.